Hello everybody, today we will be talking about HIV or Human Immunodeficiency Virus. First of all, what is HIV? HIV, which stands for Human Immunodeficiency Virus, is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, which means acquired immunodeficiency syndrome. There is currently no effective cure for HIV. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners from it. Where did HIV come from? HIV infection in humans came from a type of chimpanzee in Central Africa. The chimpanzee version of the virus, called simian immunodeficiency virus or SIV, was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. Study shows that HIV may have jumped from chimpanzees to humans as far back as the late 1800s. Over decades, HIV slowly spread across Africa and later into other parts of the world. We know that the virus has existed in the United States since at least the mid to late 1970s. How to know if you have HIV? There's only one way to know for sure whether you have HIV or not, and that is to get tested. Knowing your HIV status helps you make healthy decisions to help prevent getting or transmitting HIV. Are there symptoms for HIV? Of course. Some people have flu-like symptoms within 2 to 4 weeks after infection, which is called acute HIV infection. These symptoms may last for a few days or several weeks, and the possible symptoms include fever, chills, a rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. But some people may not feel sick during acute HIV infection. These symptoms doesn't mean that you have HIV. Other illnesses can cause these symptoms. See a healthcare provider if you have these symptoms and you think you may have exposed to HIV. Getting tested for HIV is the only way to know for sure. What are the stages of HIV? When people with HIV don't get treatment, they typically progress through 3 stages. But HIV medicine can slow or prevent progression of the disease. With the advancement in treatment, progression to stage 3 is less common today than in the early days of HIV. Stage 1 or acute HIV infection. People have a large amount of HIV in their blood and they are very contagious. Some people have flu-like symptoms. This is the body's natural response to an infection. But some people may not feel sick right away or at all. If you have flu-like symptoms and you think you may have been exposed to HIV, please seek medical care and ask for a test to diagnose acute infection. Only antigen or antibody tests or nucleic acid tests can diagnose acute infection. Stage 2, which is the chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active but reproduces at very low levels. People may not have any symptoms or get sick during this phase. Without taking HIV medicine, this period may last a decade or longer, but some may progress faster. People can transmit HIV in this phase. At the end of this phase, the amount of HIV in the blood, called viral load, goes up and the CD4 cell count goes down. The person may have symptoms as the virus levels increase in the body, and the person moves into stage 3. People who take HIV medicine as prescribed may never move into stage 3. Stage 3 is the acquired immunodeficiency syndrome or AIDS. This is the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic infections. People receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infections. People with AIDS can have a high viral load and can be very infectious. Without treatment, people with AIDS typically survive about 3 years. And that is all for our video. Thank you very much.